I'm Holly Cohen, a licensed independent broker and your host here at Preferred Medicare. Today's video is crucial for anyone enrolled in Medicare. I'm going to dive into the most popular and value-worthy plans for 2025. I'll explain how the different medigap letters compare, Plan G, Plan N, and discuss the high deductible plans, such as a high deductible Plan G. So let's get started. As we've been discussing here on the channel, we are seeing a wave of Medicare Advantage plans being canceled in counties across the country. Additionally, healthcare systems are refusing to accept these plans for 2025. Hospitals and doctor networks are struggling to keep up with the cost of care. And some insurers are deciding that it may no longer be financially viable for them to operate in those certain areas of the United States. On top of that, with the new $2,000 cap on Part D prescription drug costs coming into effect next year, Medicare Advantage plans are feeling the pinch. They're making up for the losses by cutting some of the extra benefits that were so widely advertised in previous years. So what does this mean for you? It means that if your plan is being canceled or you're seeing fewer benefits in 2025, maybe it is time to explore your other options. And that's where I can give you some information here today. So let's first talk about your options if your Medicare Advantage plan has been dropped, or if you're simply looking for better coverage. One of the biggest things to understand is that there are two main ways to be on Medicare. You can stick with original Medicare, which is your Part A and Part B, and add a Medicare Supplement Plan, also called a medigap plan, or you can enroll in a Medicare Advantage plan, which actually replaces your Part A and Part B coverage, and you receive private coverage from an insurance company to manage your Medicare. If you've been hearing the commercials say that a Medicare Advantage plan includes Part A and Part B, that's not exactly accurate. What happens is that the federal government pays the insurance company a fixed amount, approximately $1,100 per month per beneficiary on average. The sicker the beneficiary is, the more the government pays that insurance company. So what do you get in return? Sometimes a $0 premium plan, but you lose control over what doctors you can see. And as we're seeing in 2025, many plans are being cut back or canceled completely or dropped by your doctor's office or your hospital system in your area. Before I get into explaining about Medigap, if you are a person that's currently on a Medicare Advantage plan and you're looking to switch back to original Medicare, meaning you can go to almost every doctor and every hospital in the United States that takes your red, white, and blue Medicare card, remember, original Medicare only pays 80%. So it's that 20% gap that is difficult to fill for various reasons. If you're coming from a Medicare Advantage plan, typically you will have to go through a medical underwriting process to be eligible for a medigap plan, such as a Plan G or a Plan N or a Plan F or a high deductible Plan G or F. And if your health is not great, it's very difficult for these insurance companies to approve you. Everyone has what I like to call a personal enrollment window when they first start onto Medicare Part B. They have 6 months before and 5 months after the Part B effective start month in order to not have any health questions. Therefore, if you're currently on a Medicare Advantage plan and either your plan has been canceled or your doctors and hospitals have dropped it, or you simply just do not want to be on Medicare Advantage and you want to get back to original Medicare and enroll in a medigap plan, remember most times you will have to go through between 26 to 30 medical underwriting questions, health questions. Questions, you have cancer, have you had heart attack? Many health questions. Name all of the different diseases out there. I mean, the list goes on and on. The insurance companies that provide the medigap plans use an automated system typically. And once an agent like myself puts in your application, it could be declined for coverage based on health because their application system checks against a pharmacy reporting system. And they can see what medications you've taken, and it usually goes back 5 to 6 years. And if it's anything related to, unfortunately, the heart, a very serious illness such as they've had cancer within the last 2 years, some carriers will allow a person who's had cancer but is now in remission. So there's a lot of factors that go into approval once you are out of that personal enrollment window that you do initially get when you first start on Medicare Part B for the first time. Again, that's 6 months before and 5 months after, there are no health questions. You can definitely do that. It's this time of year, you're allowed to drop the Advantage plan, go back on original Medicare. But original Medicare, again, only pays 80% of your bills. And some states, it is open enrollment year round, and you don't have those health questions, such as in the state of New York or the state of Connecticut. And I will list in the description below the very few states that allow you to make changes any time of year and there are no health questions. But as a rule, most states in the United States, all these insurance companies for medigap do require that you go through medical underwriting for a few reasons. If you're trying to come off Medicare Advantage and enroll in medigap and you've had Part B for more than 6 months before and 5 months after your Part B start date, you have to go through medical underwriting. If you have a Plan F and you're looking to save money and go to a Plan G or a Plan N, which I'm going to go over those in just a moment, again, you will have to go through that medical underwriting in most states, even within the same carrier. So it's not just switching from one letter to another letter or one carrier to another carrier. It's any type of medigap change that you want to make, even if you're with an insurance company and your rate has gone up, if you're on a Plan G or a Plan F and your rate has increased. The way to lower the monthly premium on your medigap plan is to call your agent or any agent and go through the medical underwriting, get approval based on your health, and then lower your Medicare rate. There's so many factors of why medigap rates do go up. One recent development was COVID. So there was pent-up demand. A lot of people had put off scheduling procedures or even going to see their doctor for several years from 2020 through probably about 2022, even early 2023. So now the insurance companies have felt these claims. They have paid them for you. And so that's why a lot of these medigap premiums have gone up. But if you are in pretty good health, you have a very good chance of lowering your Medicare premium. And if you're on a Plan F, please look into a Plan G or a Plan N because your rate will keep going up on a Plan F. The Plan F, which was discontinued for anyone born after 1955, and that change happened on January 1 of 2020. So if you're on a Plan F, either look to, if you're in good health, either switch to another Plan F, which you can do because there are lower cost ones out there, but the best thing is to stay in a medigap letter that is open, not discontinued for new people. And that would be letter G or N or the high deductible versions of G. Now let's shift gears and talk specifically about medigap plans. The two most popular ones for 2025 are Plan G and Plan N. If you're looking for comprehensive coverage, by the way, your medigap plan can have any insurance company name printed on the medigap secondary or medigap plan card. So letter G or letter N can say Dunkin' Donuts on it for all your doctor or hospital would care. Because the way billing works when you're on a medigap Plan G or Plan N is that your doctor's office and your hospitals are billing Medicare. They're billing our federal government National Medicare Fund, and they're being paid back the 80%. Our government has a third-party billing contractor and pays back that provider the first 80%, and then goes on to bill whichever insurance company you've put your trust into and been approved by for the Medigap G or N. And automatically, that by federal law, that Medigap plan has to pick up the balance, the 20%. Again, based on the different letters, there are different gaps that those Medigap plans fill of original Medicare's. Plan G has been the go-to for many years. Plan G covers nearly everything original Medicare doesn't cover, except for the annual Part B deductible, which currently for 2024 is $240. After you pay that, Plan G picks up 100% of your Part A and Part B costs. A great option for those who want a full peace of mind with very low out-of-pocket costs. Plan N works a little differently. It's less expensive than Plan G, but you will have to pay certain copays, possibly. So you might have to pay up to $20 for a doctor's visit and up to $50 for an emergency room visit. And you also may be responsible for something called the Part B excess charges in some states. So, what are Part B excess charges? This is where things get a little technical. Part B excess charges happen when a doctor or outpatient facility doesn't accept Medicare's approved amounts for a service and then decides to charge more than what Medicare pays them for that service. 15% of that excess amount would be passed on to the patient on Plan N. The way to head off paying for any Part B excess charges if you're on a Plan N, a Part B excess charges about Part B, which is anything that's outpatient, meaning going to your doctor's office, outpatient surgery, or an MRI, something that is scheduled. So when you call that provider's office to schedule, or tell that provider or billing department on the phone that you have a Plan N, and you ask if their office accepts, or their outpatient facility accepts Medicare approved amounts. If they say yes, that means you will not have any Part B excess charges on a Plan N. Part B excess charges. This is where things get a little technical. Part B excess charges happen when a doctor or outpatient facility does not accept Medicare's approved amounts for a service and decides to charge you up to 15% more than what Medicare pays them for the service. Not all states allow these excess charges. In Pennsylvania, New York, Ohio, Connecticut, Massachusetts. If you live in one of those states, a Plan N may be a better choice because you won't have to worry about those excess charges at all. For a provider to charge the patient more than what Medicare pays them for the service. So if you live in one of those states, a Plan N is an even better deal because you won't have to worry about these charges. However, if you live in a state that does allow the excess charges, you'll just need to be mindful. While most doctors and facilities that accept Medicare stick to the Medicare approved amounts, some outpatient facilities, especially specialists or those in larger urban areas, are more likely to charge that extra 15%. So it's not super common, but it's something to be aware of if you're considering Plan N. Let's look at the cost comparison between Plan G versus Plan N. The average monthly premium for Plan G in 2024 is around $150 to $180, depending on your age and your location and your gender. A Plan N, on the other hand, can be much more affordable, with premiums averaging around $100 to $130 per month if you're relatively healthy and don't see the doctor often. Plan N could be a more cost-effective option, even with those little copays and potential Part B excess charges. So the question is, do you prefer to pay a higher monthly premium with a Plan G and have nearly no out-of-pocket expenses, or would you rather pay a lower premium with Plan N and deal with some of those copays and the possibility of the Part B excess charges? Now, if you're really looking to save on premium and you want to remain firmly planted on original Medicare, here's another option: high deductible Plan G. It keeps you on traditional Medicare, meaning you still get the full benefits of your red, white, and blue card, access to every doctor that accepts your red, white, and blue card. You just will have a higher deductible. Here's how deductible G plans work. First, you have to meet a deductible for Plan G, which is $240. That's that Part B deductible. So the high deductible Plan G does not pay the $240 deductible. Next, once you've paid or met $240 deductible, then your costs are responsible for 20% of your bill until you reach the high deductible, which there is $2,800 for the year. If you have a hospital stay, there are deductibles A. So if you are on a high deductible Plan G, you would also have to meet that hospital deductible if you have not yet met your $2,800 annual deductible for the year. If you have any questions, please feel free to comment below or give us a call. We're happy to help and assist. So here's just a quick recap. On a regular Plan G, you stay on original Medicare. You're only responsible for the first $240. That's this year's Part B deductible. That's the one gap that a medigap Plan G does not fill in. Once you've paid the $240 for the year, and you continue to pay your Medicare premium, and you continue to pay your Plan G premium every single month, you have no more bills for the year. You have 100% coverage. It is right now the most popular plan. If you want to save a little money, you take one step over and you go to Plan N, which is lower in cost, typically by $40 to $50 per month. You will incur possible $20 copays at the doctor and possible $50 copays at the ER. And yes, you are possibly the Part B excess charges. Then you also have, as another alternate, that high deductible Plan G, which usually runs somewhere in the ballpark of $50 to $70 per month, again, depending on your state and where you live. But some people, especially this year, now that so much is coming to light about the Medicare Advantage plans, and if your budget is very tight, but you want to stay on original Medicare, you might want to look at that high deductible G plan for 2025. So now that we have covered the Medicare landscape for 2025 and discussed the best medigap options, what should you do during this annual enrollment period? Or consider the high deductible Plan G if you want to lower that monthly premium. But remember, you will most likely have to go through the health underwriting questions to be approved by a medigap insurer. You can find lots of helpful information on our website, and you can also book a free 2025 Medicare review from our website. And we can go through your particular situation and hopefully help you find the best plan for 2025 that suits your medical needs and your budget. Call us or visit our website for more personalized information. PlanGfinder.com is our website. Our phone number is 855-265-6334. Thanks for watching today, and don't forget to like and subscribe for more Medicare updates. Take care, and as always, please be well.